I think we
Wonderful.
should. We've got a lot of people here and I'm sure a lot of questions. So,
All right.
Claire, are you ready?
Well, I am ready, and I
Okay.
just want to welcome everybody here to our program tonight. This is really, really special because we have Shayna Overfelt. She is really special, guys. She is the director of school programs at the organization that is administering your specific clinical board examination. It depends on where you are. It could be CDCA, REB, and then CITA. And as you know, we turn more into the Mannequin examination. So, Shayna and her team are the mastermind behind that specific examination. And I've been working with them for, I think even a few years now. And I'm just going to say, please don't think of them as like this difficult organization that's trying to make you fail the examination. They're literally are so supportive of our students and faculties and everybody, so you can start, your career because you actually deserve it. So again, welcome Shayna for being here with StudentRDH and 300 of our students right now.
It's fantastic. The adrenaline is growing as that number continues to rise. Thank you all for being here. Today really is a conversation between myself and you and Claire. I would like for you all to acknowledge Claire either in the chat or a quick emoji of a high five, or because this is something she doesn't have to do, but she puts herself out there and the organization of StudentRDH to continue to support you in new and innovative ways. This is one of those ways in having us come to you. So I've got a presentation. It really is meant to keep me on task, but I'm watching the questions in the chat. Claire's going to get my back on things that I might miss. So with that, let's go ahead and share the screen and get started on some conversations. I'm going to open you guys back up. Again, turn your cameras on if you want to. This is a lot of fun, right? The goal for you today, the goal for me, for you, is that you leave here with that confidence you need to move into this exam, right? We are here to build you up, to reassure you you're ready for this. And by being ready for this, not only clinically, but understanding the exam components and how that day is going to run will only elevate your success through this exam. So Claire, I assume I am sharing my screen and you can see it properly.
It looks great.
Okay, perfect. And just really, I am traveling today, so I do apologize. I typically wouldn't have been in a jean jacket, but you know what? You all love me anyway, and we're just going to rock on with it, okay? But first thing I want to cover quickly is the exam that you're taking is called the ADEX examination. All right, it is administered by this long, ridiculous name up top, CDCA-WREB-CITA. Those were three separate organizations that merged into one this year, or over the last really 18 months. So with that merger came a single examination called ADEX. So you all are taking an ADEX examination across the country, or you're just here to find out more information about ADEX and the benefits it brings to you. So that very first and most coveted benefit, right, is the portability that ADEX brings you. And what that means is, as you can see here on the map in front of you, every state that's purple accepts the ADEX simulated patient-based exam, which simulated just means on the mannequin. And that is the exam we are administering about 98% of all students this year. So almost 98% across the country are taking this simulated patient-based exam. I had last year's map, when we did this last year at this same time, and you can see how far advanced acceptance has come. So we've got Wyoming is the only state left in white that isn't accepting a simulated patient yet. Their board has voted to accept it, and they're moving through legislation. If you have any questions about, of course, about simulation or about portability, let me know. But this exam gets you every state that's purple, and there are 15 states within this map that only accept the ADEX exam for licensure. So this is how your pathway is getting started. Your pathway is getting started based on the exam that you take and that successful completion of it. After 3 to 5 years, you can then look to get licensed in these states by your credentials. You then have enough work ethic and work skills behind you that you can then be licensed based on your credentials and not by an exam. But for now, right, we're all in the same boat, this really fun boat of getting licensed by examination. Claire, I'm not watching the chat, so if you want to interrupt me, you know how this goes.
All right, thank you. So first, yeah, Dominic is asking, this is not about credits, right? Just wanted to, get back to Dominic.
Yep, not about credits. This, and they're a separate testing organization. So this is based on the ADEX exam administered by CDCA-WREB-CITA. So if you have signed up for an exam, there are two other testing agencies. One is credits, one is CERTA. If you signed up for those exams, this will not cover those examinations.
Wonderful, thank you.
Yep. This is the patient-based acceptance map. So if you were today to take a patient-based exam, every state that you see is purple, you could also go to. Again, over 98, 99% of the dental hygiene students across the country are taking an ADEX exam and they're taking it on simulation. Just for fun, right? How many dental hygiene programs do you think there are in the United States, right? Throw that in the chat for a second. And I'm going to tell you of those dental hygiene programs, 210 of them, or actually it's more now, over 210 of them administer the ADEX exam. So me and myself and my team are coming to your schools and administering that exam. Over 80% of dental hygiene students today are taking this exam. What you don't understand about this, because you guys are new into this, is you used to have to take a licensure exam every time you wanted to go to a different state. Every state had its own exam. So the portability of having this option as graduates in 2023 to go just about anywhere in the country is phenomenal. So there are, if you put a guess in the chat, there are about 330 dental hygiene programs across the country. A little over 210 give the exam right there within their clinics. So pretty impressive. So we've talked about who we are, CDCA-WREB-CITA, why we have such a long name. It was 3 organizations into one. And we administer that ADEX examination, which is 2 components. It is we call it a written OSCE. Technology is advanced so that you take it on a computer. I saw some of you in the chat were saying you're taking that exam tomorrow or in the next few days. And then you have the clinical component where you're showing us your hand skills for detection, removal, and pocket depth measurement. I will quickly cover the OSCE for those of you taking it in the next few days. If you've taken it, please bear with us just a second. You will have about 100 scored questions. You may see 110 to 115 questions within the queue. 15 questions are pilot questions. So you're scored on 100. You don't know which questions are pilot. So answer them all, right, correctly. Let's go for a score of 100 on this. This is going to be an exam that you take at a Prometric testing center. You make that appointment on your own. Does not have to be done before your clinical. Okay, it could be done after. So it is not a requirement to have the OSCE completed before you take the clinical component. You do get your scores right there on site. So as soon as you hit enter on that last question, your scores will be tabulated for you and given to you right then. This chart that you see is available on your manuals, also on our website, also in other recorded videos. But what you can kind of see here is the questions that you're going to be asked, the content of which those questions might be. So you see medical and dental assessment. There will be about 12 questions on medical and dental assessment. That intra and extra oral examination or assessment is sitting at 27%. And the reason that is, right, we're working in simulation. We are not bringing patients that have oral cancer lesions or pathology that is identifiable in an exam. So we move that patient to the written OSCE and you take that there. The other thing that I missed on this to tell you is the OSCE is an examination that is patient-based, meaning we give you that patient in the chair through the computer in written or picture format. So all the questions you're answering in this OSCE are patient-based questions. They're patient care questions. You are going to have the ability to look at radiographs, medical histories, right? Photographs of what we're trying to get you to evaluate. This one in the upper left asking you to evaluate, to tell us, right, of these 2 images, which is the proper way to evaluate the thyroid gland. Well, obviously, we know the correct answer from viewing the picture, so we choose that image that corresponds with the question, right? What would you have done in clinic? That's all this is about. What would you have done in clinic? Here's the information through thankfully, technology. The next question is matching, right? So maybe you've got a case presented to you. You would match one side of the scenario to the other side, which may be the answer, right? Maybe it's maybe the patient has presented with an infection, but they're allergic to penicillin. What other medication would be appropriate, right? You would be able to match up those kind of treatments, contraindications here back and forth. We've got drag and drop, which means we're going to present you with a box of options, as you see here. This example, we're showing you a radiograph. And in this radiograph, we say, is horizontal bone loss present? And you will drag it, hence the name drag and drop. We're going to drag it to the present box or the not present box, okay? And you'll do it for each of the options available. The one thing to know here, right? The students always ask me, well, can I move it back and forth? Yes, you can until you've submitted the question as complete, like I'm ready to turn this question in. So you can move them around, you can shift them. It doesn't lock in just because you put it in the box. And last but not least, hotspot technology. Again, this is where you're going to interact with that computer. This example is a great example for a dental type question, but it's very clear that we can all see the caries on the radiograph of this image, right? What's happening in the background is showing you where the proper answer is, right? You won't see the purple and green when you're taking the exam. You'll just see the radiograph. But if I had asked you to click on the caries, you would click on the caries, and what's happening behind the scenes, and I'm looking at it on my computer too with you, is the green box that any click within that green area would mean it was the proper answer. So maybe we're asking you to identify the mental foramen. Maybe we're asking you to identify the areas of bone loss that you see. And by clicking on them within the image, right? Maybe we're asking you to identify the areas of calculus you see. That's how you're interacting with these questions. So Claire, I've kind of quickly covered the OSCE, but I want to come back to you. Do we have any questions in the chat?
So I think we covered about the drag and drop. One last question is the images, can we expand them? There is, isn't there a magnifier function?
Yep, you'll be able to zoom in if you need to. This example, right, is spread out over 4 examples. So yes, you're going to have an image that's bigger, more visual to see than the example in front of you. The other question I don't think I covered, Claire, is you have 2 hours to complete this exam. So you'll be there, you'll have 2 hours, and then you'll get your scores before you leave.
Great. So 2 last questions that just came in. Can you skip a question and go back?
You can skip a question. If you skip the question, don't answer it, right? If you want to skip it and you want it to come back up, you can. On the last webinar I did, the students were telling me you could also flag the question and come back. So pay attention to the instructions when you get there. You may be able to flag it, and if you've answered it, flag it and come back, or just leave it blank and it will come back up in the end.
Wonderful. What happens if you accidentally click something? I'm assuming you have not submitted yet, so you can still play around with it.
Yep, absolutely. And until you've hit send in, right? If you didn't mark it to come back, then yes, you can mess around with it until it's sent off for final answer. Kind of like that game show, right? Who Wants to Be a Millionaire? When you would say, this group might not know what that is, I'm telling my age, but Who Wants to Be a Millionaire? And he'd say, is that your final answer? And he'd say, yes, it's my final answer.
Right.
The drop and drag, does that count as 1 question or 10 questions if there's 10
great.
drop?
Great, Lisa. Yep, this would count for a multitude of points. They may be a half a point, so it would equal 5 points built into that question.
Okay, because that seemed like a lot of questions in 1 question, boy.
Yeah. So all the answers you get correct, you earn the points. If you lose or you don't answer it correctly, you would lose the points. But the points aren't a point apiece typically. It's typically built in to equal maybe 4 or 5 points.
Okay, thanks.
Yeah.
Thank you. The last question is, I think Gina is asking, what's the difference between an OSCE and a CSCE? I know it's terminology. I know, once you know, it's easy. Can we just run through that quickly, please?
Yes.
Get 'em!